Hi, this is Ms. Slowicki, and I'm going to talk to you about the concept of inflammation. These are the objectives for the presentation. I'm not going to read them to you, but they're just from the front of your text. Inflammation is a nonspecific response to what the body sees as harmful events. They can be external things. Anytime your body gets injured, whether it's a cut or you're having a stroke or a heart attack or you have an infection, anything like that, the body sees harmful. It can be triggered, or autoimmune disease triggers the inflammatory response, and that can cause tissue damage. The inflammatory response is considered protective. The body's trying to maintain its hemostasis, and so that's what happens. It will help stimulate healing. Characteristics include pain, swelling, redness, heat, and impaired function of whatever the organ or area that's injured. Injuries can be caused by physical agents such as mechanical objects like a cut or a burn or something like that, chemical agents such as acids, alkalis, poisons, or internal agents such as excessive hydrochloric acid in the stomach. The inflammatory process is a vascular process, and it's triggered by the harmful stimuli that we just talked about. It can be acute or chronic, and what happens is your body gets injured for whatever reason. There's a sudden surge or release of histamines, kinines, prostaglandins, um, chemokines, things like that. And it's the body's response to whatever injury it is. The blood vessels start to dilate. Then what happens is you get an increase in vascular permeability. And so we've talked about that before when we talked about albumin levels. Your your vessel wall doesn't stay intact, and so you will start to get leaky tissues or fluid leaking into the interstitial spaces. You get a slower blood flow to that area, and then you start to get the white cell and the leukocytosis action. After that, you can get exudate production. So it's inflammatory exudate is produced. We sometimes call that pus. It's serous, it's purulent, it can be bloody or hemorrhagic. And then your body will go into a reparative phase in which the regeneration of that area tissue begins to form and scar tissue forms. This is just a visual of what's happening in acute inflammation. This is from your book. Some of the ways that the inflammatory process happens, one of the most severe is anaphylaxis. That's a life-threatening allergic reaction. Clinical manifestations include inflammation of the airways, swelling of the throat, wheezing, and labored breathing, abnormal heart rhythm, low blood pressure, weakness, lightheaded, dizzy, nausea, vomiting, diarrhea, cyanosis, hives, itching. If you've ever experienced anaphylaxis, or I've experienced actually laryngeal spasms, not quite that full throat swelling, but just that hard, it was like my body was trying to cough out the irritant. The treatment is epinephrine. So somebody with known reactions to things like bee stings or peanut allergies, they're supposed to keep an EpiPen at all times. These days, the EpiPens, from a patient teaching perspective, are self-injectors, and sometimes there's verbal directions that it'll give. The epinephrine dilates the airway and narrows the blood vessels. That counteracts the response. It can be given IM or sub-Q. And it's important for you to understand the dosing, because we give epinephrine in various areas in nursing for different types of things. So it's important to know what kind of dose you give if it is a for allergic reaction. Other things we might give beta agonists, we might give antihistamines or corticosteroids. Antihistamines are to stop that histamine response, and the corticosteroids help to reduce that swelling. Severe reactions may require emergency tracheostomy. Alterations in immunity include autoimmune disorders. So what happens is that the body starts to misinterpret or react against its own tissues. And so the types of those would be rheumatoid arthritis, lupus, Guillain-Barré is another one. Mild alterations we treat with rest and reminders. And if it advances to where they get an infection, that requires treatment for the acute inflammatory response. Again, manifestations include redness and swelling, localized or generalized responses. So, if it's something that's happening to an organ, like inflammatory bowel disease, you might end up with the symptoms are associated with what the organ that's being attacked is. So, like for rheumatoid arthritis, for example, you get swelling of the joints and you start to get deformities because that's happening over time. And that, like inflammatory bowel disease, you get structural changes to the bowel. There are some genetic and non modifiable risk factors, and the genetics risks vary. Native and Mexican Americans are at risk for gallstones, as well as this sentence isn't structured properly, but females are also at greater risk for gallstones than males. African Americans are more likely to develop nephritis as a complication of lupus. And family history plays into the peptic ulcer disease. And rheumatoid arthritis women get more frequently than men. Again, the symptoms that you see are pain, you get edema, so you could have swelling. And again, it's going to depend on the area. So you might have decreased mobility if it's a joint or area that's injured, like in rheumatoid arthritis. You might get shortness of breath if it's that anaphylactic type reaction, and swelling. Heat, you might have, this can be localized or systemic. When it becomes systemic, that is of greater concern. But at the area, the skin is warm and red and might be hot to the touch. Impaired function, we've talked about that. They can have decreased mobility, difficulty breathing, pain, altered mental status. They could have an alteration in oxygenation, such as cyanosis, labored breathing, dyspnea. And it could develop into an infection, or infection triggers the inflammatory response, and we talk about that a little bit in infection. But the inflammatory response is triggered in infection. So inflammation, pain, mucus production, purulent drainage, hyperthermia, malaise, nausea, vomiting, diarrhea, and headache. We do relate the concepts. Immunity relates to the inflammatory response. We've talked about infection already. Mood and affect, when we're looking at things like chronic disorders that can impact the mood and affect. Oxygenation, if we're looking at something that causes a swelling of the airways, that can be impacted. And safety, if their mobility is limited. Health promotion, we want to encourage them to avoid triggers, anything that triggers a reaction. So if going out in the cold triggers the response, or whatever stress is often a trigger, things like that. There are modifiable risk factors. So things like Crohn's disease, they can make dietary changes that can reduce the risk. Again, certain foods might trigger their exacerbation of their Crohn's. Gallstones, we want to reduce the risk by maintaining appropriate weight and encourage a high fiber, low fat diet. Nephritis, control their blood sugar, try to control their blood pressure, and avoid the use of NSAIDs. And then early screening can reduce them, or screening for disorders, especially if there's a genetic or familial history, can lead to early identification and early treatment, which reduces the mortality. Assessment, we always start with the observation and patient interview. Again, the physical exam we've talked about all of that. There's going to be local inflammation. Diagnostics, we're going to look at the erythrocyte sedimentation rate, and that's going to be elevated in inflammation. C-reactive protein is found in blood produced by liver and fat cells. That's also going to be elevated. We're looking for the white blood cells. Any elevation may or may not elevate, but likely it will, and which of the white cell elevates. Interventions include antipyretics if they have a fever, and they may do antibiotics if it's caused by an infection, or they may have steroids. We already talked about that. That will help reduce the swelling and slow down that inflammatory response. Teaching to prevent further injury and to take their prescribed medication, and always a balanced diet and exercise. NSAID, there are, depending on what the disorder is. So in nephritis, we want to avoid the NSAIDs, but NSAIDs can help reduce that swelling, the inflammatory process. And so sometimes we'll give NSAIDs as treatment, and then analgesics and antipyretics if there's pain. Lifespan, children and adolescents may have some structural differences that result in more complications. Underdeveloped glomerular filtration rate in infants. GI inflammation can decrease nutrient absorption, so that leads more to malnutrition for them. And the immune system response is a little different than adults. Pregnant women, preeclampsia is an inflammatory mediated hypertensive disorder that can lead to toxemia. And then older adults, they may have an increased inflammatory markers due to poor overall health.